we go back to for healing and recovery is from the land. So that comes from our food and it comes from our medicines.
Health leaders from across the country and internationally that have come to see what we do here, because we offer something that truly is culturally appropriate services within a hospital environment. Cultural programs that we're really proud of are the traditional food and traditional medicine programs.
I personally feel that it's really a gift to be able to offer the patients traditional medicine while they're here in the hospital. They have come often from a community far away from Whitehorse. They're in an unfamiliar environment. They don't know the people around them. They don't always understand the care that they're receiving or why they're receiving it. So if we're able to come in with traditional medicine that they identify, that they recognize, that they're comfortable with, and they know what it will do for them, it gives them a sense of peace and calm.
Our culture includes being connected to everything around us, our environment, the other people, the land, the water, the plants, everything. We're a part of that. So to have that here, having other medicines and other practices applied, gives us that comfort, I think, to be able to embrace what's happening to us at the time.
One real challenge in a system that has its own culture in healthcare is just that idea that somehow First Nations are provided special treatment, or there's something over and above what everyone else gets because of the existence of our program. And so that's certainly a message that we want to work with staff and patients and families just to understand the systemic disparities that exist, and that's really what we're here for.
When a patient upstairs wants traditional medicine, they speak to either the liaison worker or the cultural program coordinator and make their request. The liaison worker and or the cultural program coordinator will then speak with the doctor as to the request made by the patient to find out if it is compatible with the care the patient is currently receiving. When the doctor gives the approval, the cultural program coordinator then contacts an elder from a close community to where the patient is originally from, who is then able to provide them with traditional medicine while they are staying here in the hospital.
I understand that a lot of medicine is evidence-based, but also there is a lack of evidence in a lot of things that we do. We do it because it has worked in other areas. So I'm very, very open to traditional medicine and food being given, because there's no hard set theories unless there is something critical going on that I say, look, this cannot be done, and it's an open discussion.
Traditional food is almost a direct line to traditional medicine. Food is medicine. Food is healing. Food is a huge comfort zone. Food has such a huge role to a patient in a hospital, and if you're able to offer them something other than the standard hospital fare, it does insurmountable things for the patient in the bed to receive a moose stew in front of them that reminds them of their home community.
Western food is processed. It comes up on trucks. First Nations foods arrives on its own. It walks up here. It swims up here. When it gets to the Yukon, it has struggled long and hard to get here. The quality of the meat is much higher. The freshness is unsurpassed. The actual nutrition, the content of it is far greater because of how the animal has to subsist on the land to get to where it is before it gives itself to us. And we're very, very lucky. And I can't express that enough, how lucky we are that we can partake of the land and we can experience this, because unfortunately a lot of people spend a lot of time in a hospital, even short-term or long-term, and yet can't have that level of comfort of a little piece of they're bringing with them, and we can do that.